Dr. O'Leary will brief you on the President's operation and on his condition, as well as that of the Secret Service agent. Following that, Sheila Patton, who is Mrs. Reagan's press secretary, will have a word to say about Mrs. Reagan. So now, let me introduce to you Dr. Dennis O'Leary. Doctor.
Thank you. There's the podium. As Mr. Nofziger has told you, the President is in the recovery room. He is in stable condition, and he is awake. He was in no time in any serious danger. He was alert and awake with stable vital signs up until the time he underwent anesthesia. He was in the operating room for approximately 2 hours. Part of that time was spent ascertaining that he did not have any blood in his abdominal cavity. Indeed, he did not. It was a single bullet wound that entered slightly underneath the left armpit. It traversed about 3 inches of the chest wall and then ricocheted off the 7th rib into the left lower lobe of the lung and moved about 3 inches into the lung substance itself. The operative incision is about 6 inches in width, relatively simple procedure. The bullet was removed and then the incision was closed. And as I say, he is stable and in good condition.
What is the prognosis?
The prognosis is excellent.
And you're saying that he will no doubt recover. How long?
That is always difficult to say. The President, however, is an excellent physical specimen, and we do not anticipate any problems. It is always hard to be precise as to how long he'll be hospitalized, but he is clear of head and should be able to make decisions by tomorrow, certainly.
Did the bullet fragment when it hit the lung? Did the bullet fragment when it hit the lung?
The bullet was distorted, and we believe that it probably was distorted by virtue of impacting against the 7th rib, which redirected its path into the lung tissue. We do not believe there's any permanent injury. The heart area was explored. The heart was not involved at all. There were no major bleeding points in the lung, and there was no involvement of the aorta, the major vessel running through the chest. The lung has been reinflated. He has a couple of chest tubes in. Excuse me? I can't hear you. Okay, Mr. McCarthy had a single bullet wound also, entered the posterior right chest and passed through the lung tissue, causing virtually no damage at all except for the passage tract, passed through the diaphragm into the dome of the liver, and passed through the liver into the lateral side of the chest where it lodged against the end of the 11th rib. Mr. McCarthy did have blood in his abdominal cavity. The same test that was performed on the President was also performed on him, and it was positive. The abdominal cavity was carefully explored, and the only damage was the bullet through the liver itself, and a drain was placed in this area, and he is doing extremely well. Has been in the intensive care unit now for about 45 minutes.
How long would you anticipate?
James Brady.
Okay, Mr. Brady is still in surgery. His condition is critical. We don't have any further information at this time.
Dr. O'Leary, how long would you anticipate that the President would remain hospitalized?
Now, that is difficult to say. Might be as long as 2 weeks, but that is just a guesstimate at this point in time.
Hasn't been given any blood? How much blood do you have now?
Sorry. Okay.
Remain here, Doctor.
That's not for me to answer. Question was the amount of blood. The President required a transfusion of approximately 5 units of blood before surgery, but none during the course of surgery. Mr. McCarthy required no transfusion at all.
The D.C. policeman, please.
The D.C. policeman was taken to the Washington Hospital Center. We have no first-hand information on him.
About Mr. Brady's injuries.
Well, Mr. Brady was shot in the side of the forehead. The bullet went, I'm not certain, sir. The bullet did pass through his brain and came out the other side. He obviously has significant brain injury, and he is in critical condition, but I'm sorry we have no further information at this time.
Who performed the operation on the president?
The operation on the president was performed by Dr. Ben Aaron, who's on our full-time faculty here as a cardiovascular thoracic surgeon. Last name is spelled capital A, small a, R-O-N. First name Benjamin.
Title?
I'm trying to think. I think he's an associate professor of surgery.
You would anticipate no further surgery necessary?
The other surgeon was Dr. Joseph Giordano, Giordano, who is head of our trauma team and was in the emergency room almost simultaneously with the arrival of the president.
Why did the operation take so long?
The length of the operation really had a lot to do with the testing to make sure that there was no bleeding into the abdominal cavity. That took about 45 minutes.
What was that test?
It's called a peritoneal lavage. Peritoneal lavage, L-A-V-A-G-E. Okay, that test is important, is very simple. A small incision is made beneath the umbilicus, and several liters of fluid are placed into the abdomen, and then the fluid is brought back outside and looked at to determine whether there's any blood in it. That fluid can move anywhere throughout the whole abdominal cavity, and if any organ has been damaged and there's any bleeding, one will find blood in the fluid that comes out. That test was negative in the president, and as I said, positive in Mr. McCarthy.
Doctor, in view of the president's age, is there any danger that the lung might collapse again?
Very doubtful. The president is physiologically very helpful. Caliber of the bullet is going to be very hard to tell in the president because it was a really mangled bullet.
Is there a possibility of any other complications besides the lung problem?
It's really doubtful. Again, I would emphasize that he is physiologically very young. In good shape.
The bullet entered at what angle? From the front, from the rear? Can you give us a...
Well, one would assume that it probably seemed to come from a little bit top down, entering approximately here, traverse down. Yeah. Traverse. Okay. Traverse down approximately 3 inches, striking the top of the 7th rib laterally, and then going about 3 inches into the tissue of the lung itself.
It deflected downward further from the 7th rib?
No, it's like coming down, hitting the rib, and then deflecting in to take a new path about and then...
Lose blood.
It was in the parenchyma in the tissue of the lung itself, contained within the lung itself.
But you said the president was conscious through much of the time. What, if anything, did he say?
Well, the surgeons said that his last remark before he underwent anesthesia was he wanted to make sure that all of them were Republicans. They said that today everyone is a Republican.
How narrowly did the president escape mortal injury?
That's a hard question to answer. As I stated, he was never in any serious danger. The bullet was really not very close to any vital structure.
Not so close. How far from the heart?
Probably several inches.
Was that because it struck the rib? Was it fortunate?
If it had not struck the rib, it might not have even entered the lung cavity.
Passed through his body without doing
And it could have passed right through the chest wall if it had not struck the rib.
General anesthetic used. Politically speaking, the president is fully able to discharge the duties of his office as of now.
I would say probably not. Now, one has to let the effects of the anesthesia wear off, but I think all of us feel that by tomorrow that he would be fully capable of doing that.
There was a basic decision he had to make tomorrow, of decision of state of some significance. Would he be able to do it?
We believe that he would be able to do it.
Dr. Brady. Who's operating on Dr. Brady?
Okay, Dr. Arthur Cobrine, K-O-B-R-I-N-E. Cobrine, K-O-B-R-I-N-E, is operating on Mr. Brady. Arthur. He is an associate professor of neurosurgery.
Is it possible to give us any prognosis on James Brady?
it's really not possible right now. As I said, he's in critical condition, but anything I would say would be highly speculative.
Permanent brain damage.
Not at the present time, although in the operating room, remember that you've got respirators and monitors and